I am one of them. I know how they are feeling, what they need, so we can understand them very well.
It is my wish for them to go in a better place, to take out of this stressful place.
I think I should work till the last refugee be in this island, and I should help them.
I feel like these are now not just my opportunities, but the opportunities of those individuals who want to do something bigger with their lives, maybe even leave a legacy for the sake of humanity. I was really pleased to be going to Greece. I was familiar with it as a holiday destination, so it didn't feel too bad. My family even let me go because it isn't a war zone. But obviously there was something happening there. We heard about the people, we heard about children and families, and we heard about the deaths. I felt that God heard my prayers and He understood my intent, and He knew that it was time for me to go to the other side and to be there myself and to do some of the action myself. Many patients have commented that they notice a level of barriers taken away between us and them in our clinic. So when we came to the clinic, we were only doing an emergency cover over the weekend. We were quite intrigued to find that patients were coming to us saying, oh, actually we were waiting for you to come back at the weekend because we find that we get a little bit more medicine or listened to a little bit better. There was something different about the way we were looking after them. So it was interesting. When I was there, I saw many people, as I said, people like my own family, and I think when you see children, the first thing you do, and it's always been the case for me in medical school as well, when you see a child, the first thing you do is you see your own child there. I'm always at my best when I'm looking after children because, as I say, I'm a mother myself, and I think I do know how to relate to them. And this little girl was not just an ordinary child, she was disabled and she was living in a refugee camp and traveling with her mother. And there are many children like this who are so traumatized, and she was so lost in a way, but continue to be lost and don't know where they're going. And this is the plight of the people in this refugee camp. They actually, have no future, and if there was anybody who was going to be depressed, it would be them. But yet, the irony is those people are there because they have hope. They have hope despite everything against them and all the evidence of the political barriers. They still have hope that they will be better off in some way.
magacayga Sahra Cali Raagi Soomaaliya u dhashtay waxaan u faraxsanahay markaan imaaday sokorta ayuu kacsanaa imaaday si fiican uu isoo dhaweeyay dhakhtarka wiilka jooga bacdeen sokorta iga cadeeyay waqti kasto sokorteedu la soconayay daawooyinka isiiyay si fiican markaan dhakhtarka imaado mali celiyo dhaqsiyaali soo deeyaa cashan xanuunsan tahay ii dadaalaan inta waxaan ku imaaday Soomaaliya ka soo tagay Turkiga imaaday Turkiga markaa imaaday gabadheeda xanuunsan dhakhtar markaan geeyay lacag badan iyo muddo badan dheer ay qaadanay dhaheen caafimaadkeeda si ay u socoto ilaa 10 sano laga yaabaa inay ku caafimaado ay ku socoto saas darteed lacagtu awood waayay waa iska soo tahriibo soo baxay doona soo raacay kuma dhalanin bas laakiin dadaal aan ku noqoto dhakhtarka oo dadaali waayay عشان markay dhalatay waqti isbuuc dhalanaaday xumada ku dhacday xumadii darteed saa u noqotay warqada caafimaad dhakhtarka sameeyay bacdeen waxa geeyay dhakhtar ka bacdina waxay dhayn inta ma lagu daaweyn karo balan dhakhtar ay sameeyeen ina mataliin aan geeyo oo dhakhtarka neerfaha loo geeyo ballanteedana beri waay waxaa ugu ducaynaya gabadheeda inay u socoto sida ciyaalka faceeda kaleeto u soconaya inaa insha allah haddii oon helo sida aan rabo inaa ilmaheyga aan hal meel iskula noolaano haddii gabadheeda inta igu caafimaado oo daawo ii hesho waa saa rabay haddii aan waayana inaa jarmalka aado عشان عافمتها.
Having developed Kitrinos Healthcare to where we are at the moment, I should say that Kitrinos derives its name from our yellow ambulance. Kitrinos means yellow in Greek, and it's only because it was the colour of the ambulance that enabled us to facilitate our services. In 2015, there was a time when the whole of Camp Moria was actually empty. Whether people had stopped coming on the boats or at that time the borders were still open and people were able to get away quickly. And I realized that actually having a clinic that is in a tent or any fixed facility when you're following migrants is probably not the wisest thing to do. And so we started looking at ways where we could follow the people. So we would follow them to the port, we would follow them to wherever they were congregating and needed care. So when I realized we needed to follow the people to where they were, someone actually donated a small ambulance for us to work with, but it wasn't ours. And we found how beneficial it was because the minute the ambulance turns up, we pop open the boot and there would be queues of people around us. We would make one line for the women, one line for the men, and we were there from dawn till dusk often, and we could just be so productive. We could go back and restock our medications, take the doctors to where they needed to go, and provide the services on site again. The first clinic that we ran in there was actually a women's health clinic. And we had the women queuing to meet with us and to be attended to. It was very popular.
So this is the inside of our big ambulance, Mama Kitrinos. She's been designed with purpose-built couch here for examining and resuscitating people. There's under couch storage, which was made so we could keep extra blankets and sleeping bags in. There's a couple of seating areas which served as an area for just allowing people to de-stress if they were really upset. Families who are waiting provided a safe space if someone like elderly and frail needed somewhere to sit down instead of standing outside in a long queue. We've been able to do minor surgery in the back here. We've set up emergency equipment at the top. It's come with lighting and air conditioning to make it comfortable. Certainly if someone was hypothermic, then there was the ability to provide warming services for patients. The ambulance is a fundamental part of the beginning of our work, the middle of our work, and now as we continue to run with actually very little financial support, we find that she is actually helping us to save on transport costs, both for the patients as well as for our organisation. So it brings the team to the clinic every morning and takes them away. When we need to go and get supplies, when we need to carry clothing, for example, if we have an outbreak of scabies in the clinic, sometimes we need to get like 20, 30 whole full sets of a change of clothing, bedding. We can use the ambulance for that as well. So it's been such a versatile and amazing investment for me personally. I would want this to be the beginning. If I have a wish, I would want people to know that we started very humbly and we run our services very humbly. We're not extravagant. And the idea is to maintain intermediate or long-term sustainability. So, sometimes the ambulance needs a little help. It's got a leaky roof at the moment. So there's little, when it rains heavily as it has been this winter, it will be covered in water inside. Sometimes it needs a new battery or some new tyres or some new wipers, just like any vehicle. So these small costs, actually, they're not huge, you know, what, 50 euros sometimes, maybe 20 euros for some wipers. But the extra mile that goes in providing a service, carrying people safely backwards and forwards, providing clinical services, carrying medical equipment, the rewards are not measurable, infinite actually.
I love the Greek people, I love the Greek establishment, I love Greece, I love everything about how they've handled this situation. I have huge amount of respect for them, and I think, to me, they're the best country in the EU right now, possibly the best country in the world, because they have really given me an insight into how it could be if other countries just sat back and watched what this poor country, with its diminished economic status, how it has opened its hearts. The people have opened their hearts and done the best they could. As Muslim myself, we know about the time when our Prophet Muhammad, peace be upon him, traveled to Medina, and how he was welcomed by the people in Medina who opened their own homes, gave from their own clothes, fed from their own food. I have witnessed this in Greece. On the island of Lesvos, in the northern borders, I have seen families who've done exactly that. They've taken from their children's clothes and given to the children who are landed on the beaches. And not for showing off, but completely because they knew this was the right thing to do. The last signs of humanity, for me, seem to be in Greece. And for as long as I can and for as long as it's needed, I would love to continue serving there. Vangelis in particular is a prime example of how good-hearted the Greek people were. So in his hometown of Drama, which is quite close to the Turkish border, he was involved in campaigning at his local sort of council level, and he wanted to be one of the first who greeted the first refugees who were given a place to stay in Drama. A very gentle and passionate man about the cause of refugees and about the cause of the displaced and supporting them. He is trained at university as a lecturer and a teacher, but he left his teaching jobs to become a coordinator for me.
My name is Vangelis Kalfopoulos. I'm Greek, and right now I'm a trustee for the Greek Kitrinos Healthcare organization, and I was working as a ground operations manager for Kitrinos for 2 consecutive years. I think that the medical services, the medical provision that organizations like Kitrinos provide are one of the most basic fundamental human rights. People need to be healthy. They need to monitor their health. We have seen various people with various conditions, elderly, people with severe conditions, and these people they are of course in a very difficult setting as refugees. They don't have access to healthcare. They are in a country, Greece, that they themselves presume it as being a transit country, so they don't want to stay here and they don't really learn Greek language. Or even for the ones that do stay here, they do get asylum here, it's very hard for them to get assimilated in the society and to use the healthcare that Greece has, the healthcare system that Greece has. I think that if there is a need again, Greeks will do their best, because Greece, you might already know, most of us in the north, at least, of Greece, we have a refugee background ourselves. Most of our grandfathers, grandmothers came from Asia Minor to Greece, as refugees like 100 years before, so these memories are still vivid in the Greek minds, and I think that's a driving force, especially in an island like Mytilene, for example. This is a driving force for people, for locals, to help people that find themselves in the same situation, even if it's different cultures or if it's 100 years after. My wish for Kitrinos is to be in a position to provide for all these people in the future.
So when I used to do my mountainside olive grove clinic or ward round, I was observed by one of the local Greek merchants. He had a warehouse situated right next to the olive grove, and he was such a lovely man, and he made it very clear how dedicated he was, and to this day his family continue to serve the people. Amazing humanitarians. They are ultimately gold standard humanitarians, and they run their business, and I'm so pleased to say that their business is becoming extremely successful. But I know that the one reason they do it is because they do it for the comfort of the people around them. They've opened their shop hours, so they're open till 10, 11 p.m. if needed. They open at the weekends if needed. The family are exhausted, and often I find myself giving them a consultation or two just because they haven't had time to go and see their own doctors. Mercia is my sister. She's my sister from another mother and another father.
My name is Mercia. I'm the daughter of the owner of the warehouse. We are in Moria. We are right next to the refugees. This all started in 2015, but there weren't so many people. They used to come for a few days and leave. But I think the last 2 years, there are many people in Moria. I think there are about 10,000 now. I'm very next to these people, and I understand the problem. Being in a tent all day, not knowing the future, what is going to happen to your children, to yourself, to the family you have left behind. I feel sorry, because they left the house, they left families, work, everything. We used to have this shop, but we used to work as wholesale for hotels and for restaurants. Now we are selling stuff to the people too, so they can feel a little bit better. Not only eat Greek food, rice or vegetables, they can find their own stuff. I want them to feel comfortable. I want them to be happy. I want them to be happy because they are here a long time. I would tell Greece to help them to leave, to go to the destination they want. Not leave them here so many years in a tent. Do something, help them.
Maria is my mum too. I think she volunteers herself. She used to volunteer for the Red Cross fairly regularly. She's what she is. She's like a mum, and she tries to mother absolutely every single person in that camp, to the point of her own detriment and exhaustion, and she's really neglected herself for it. But she loves it. You can see that. You know, this is, I suppose, for all of us humanitarians, if we die doing this, we will die with a smile on our face.
I'm Maria. I'm the owner of the shop, okay? With my husband and the 2 children, we're having this business. We had it long time ago, but now when the immigrants came, we opened the shop to be near them and try to help them as much as we can. It was hard work at the beginning because we couldn't speak the language, but we tried and they tried with us, and we're doing very well at the moment. We try to give them as much as we can. Sometimes it's difficult, sometimes it's easy. It's lots of nationalities, lots of languages. It's hard, very hard, but it's all right. I'm still with the Red Cross, but not as much as I want to because I'm here. as a Red Cross, you could give more, but in the shop you can't give much. What can you do? You know, okay, all the time they want fire, we give them pallets, we give them as much as we can. This is what I feel sorry for them, the babies. They shouldn't be here.
As I look back and I think about the journey that I made through the beginning, coming as a doctor with medicines in a bag on my back and the little light on my forehead to navigate in the dark, and now we have a fully functioning clinic with donated medication, equipment, people, amazing people we are people powered actually. But having got to where we are at the moment, I would like to think that this is the beginning. Of course, one can never be satisfied with aspirations that I have to serve more people, to serve people of other parts of the world, perhaps in places like Yemen or other disasters. My own country, Sri Lanka, has recently had difficulties again. Palestine and Gaza, all these places call to me. They've always been ingrained in me and became part of me as I tried to grow as a human being. And I hope that this is my practice run for developing something, setting up a service that I hope, God willing, I'll be able to replicate in other parts of the world.